module on aortic valve disease. We have covered the module on mitral valve diseases, and what we specially read in the mitral stenosis was the cause was mostly rheumatic heart disease, mostly rheumatic. So now moving into the aortic stenosis, let's see whether the etiology kind of changes or remains the same. So first of all, if you look into the anatomy, the aortic valve is mostly has got three cusps, right? It has got a three cusp. So this is how it looks like when it is stenosed, and this is the normal. This is the normal. But aortic valve can also be bicuspid. Can also be bicuspid. So we call that bicuspid aortic valve. Now, certain points regarding the bicuspid aortic valve. It is the most common congenital valve defect. The bicuspid aortic valve is the most common congenital valve defect, and it is predominantly seen in males. It is predominantly seen in males, right? And it has got predisposition to develop aneurysms and dissections. So there is a predisposition to develop aneurysm and dissection. It also has got an inheritance pattern. It can be autosomal dominant, it can be X-linked also, right? That's why bicuspid aortic valve is also seen in Turner syndrome. It is also seen in Turner syndrome, okay? And bicuspid aortic valve can be part of a complex known as Schoen's complex. It can be a part of something known as a Schoen's complex. Now, what do we get in Schoen's complex? We get something known as parachute MS. We get something known as parachute MS. If you have read the module on mitral stenosis, I had mentioned that there is in the congenital MS, I had mentioned about something known as a parachute MS. So they have parachute MS and they have coarctation of aorta. They have subvalvular AS and they have a supravalvular obstruction. Okay, so these are the four components of basically Schoen's complex. So coming to the causes of aortic stenosis, unlike mitral stenosis, the aortic stenosis is mostly not about rheumatic heart disease. Rheumatic heart disease is one of the causes of aortic stenosis, but it's not like only the rheumatic heart disease is playing a role in aortic stenosis, right? So the causes can be number one, rheumatic. Apart from that, calcific aortic stenosis is also common. It can be due to radiation and it can be due to the endocarditis, right? Now, calcific aortic stenosis is very common in 6th to 7th decade. It is very commonly seen in the 6th to 7th decade, right? Now, I have mentioned about the bicuspid aortic valve. Now, in the bicuspid aortic valve, in contrast to the calcific AS, the symptoms develop 5th to 6th decade. In calcific, it develops at the 6th to 7th decade, whereas in the bicuspid, it develops in the 5th to 6th decade. Okay, so this is important. So a decade earlier, we see in the bicuspid aortic valve, right? Now, what I was talking about, the component of calcific aortic stenosis. The calcific aortic stenosis is also very common in contrast to the rheumatic heart disease. Now, when the aortic valve gets stenosed and say at the age group of 6 to 7 decade, and when you start looking into the valve by the echocardiography, it becomes very difficult because the valve morphology is so much distorted that it becomes so much difficult to recognize whether it is due to the calcification or it is due to the rheumatic. So remember one thing, when we have a rheumatic AS, right? And we have AS due to other cause. How to differentiate? How to differentiate? You can have isolated